Dear boomers, Alzheimer's disease. This is what we're going to talk about today. And what the best way to prevent it is through an adequate sleep, exercise, and nutrition. So we'll start with that idea. And did you know that 50 to 55 million people globally are currently diagnosed with Alzheimer's? And that number is set to triple 2050. But here's the shocking fact: only 3 to 5% of these cases are driven by genetics. So even though my dad had Alzheimer's, that does not mean that I will too. That leaves 95% of the diagnosis are caused by other factors. So what can we do to prevent this terrifying disease? And why are we terrified? We must embrace what we can do to prevent it and take action on these things. So we're going to discuss the 3 key issues. There's so much more detail about how the exercise and how sleeping and even nutrition can affect certain areas of the brain and release hormones or release neurotransmitters that rejuvenate and are regenerative. But I don't know if we're going to cover that today. So let's talk about sleep. Sleep is something we should pretty much sleep the same time every day. So for instance, if I plan to sleep at 10 o'clock tonight or every night at 10 o'clock, what I need to do is prepare for bedtime at 8:30 or 9 and create a situation where I'm not watching anything on social media or YouTube or movies on TV. Just create an atmosphere of rest and rejuvenation. And when I sleep, when I do get to bed, I need to stay away from alcohol and what I have just been listening to, and marijuana. Even though marijuana can help with your sleep cycles, and we know that alcohol disrupts sleep cycles, but I have noticed with my own medical marijuana prescription that my REM periods, I can't remember my dreams. So I'm going to start just basically easing out that part of that habit, you might say. So Alzheimer's is a neurodegeneration disease which can actually start developing years before you even notice it. Starts as early as in your 30s. And by the time memory loss, the first sign of Alzheimer's, sets in, it may already be too late. Now, we know miracles occur in all these aspects of health, of any diagnosis. Take, for instance, going to a Joe Dispenza week-long meditation event, which focuses that many times people show up with crutches or in wheelchairs with terrible depression. And after the week-long meditation and just the energy that is percolated up by everybody there, people actually can throw away their crutches and throw away their wheelchairs. And Joe Dispenza has really gone into this. He has a new movie called The Sources Within, and that has to do with we need to take control of our life in such a way that we live in the quantum fields instead of this reality, you're going to get Alzheimer's and it's 1 in 3 and it's the women who are going to get it. No, I'm not saying that. But what I am saying is we need to do certain things that actually are helpful, not just for the brain or for Alzheimer's, but good for the holistic qualities of our life. Okay, so getting that out of the way. Good sleep is very important. Deep sleep without, as I say, alcohol or marijuana. And in deep sleep, the brain goes through what is called a cleanup process, where proteins like amyloid beta, which is associated specifically with Alzheimer's, these things are flushed out. Think of it like a nightly garbage collection system for your brain. If you're not getting enough sleep, that garbage builds up, forming harmful clumps in the brain that contribute to neuron death. So, aim for 7 to 8 hours of sleep. Keep that regular sleep schedule. Your brain likes routine. Who would have ever thought? And I think our whole body likes routine. And we may not always, routine is another thing Joe Dispenza says, don't do the same thing at the same time, day in and day out. But when it comes to sleep, it may be a very good idea to follow these instructions. Exercise is the game changer for the brain. This neuroscientist that I was listening to says we should aim for 12,500 steps a day. I try to aim for 10,000 steps, but my little dog and I can go a little longer today and see how that works out. A sedentary lifestyle. We have discussed that in we have this motto. He makes me laugh all the time. Laughter is very good to prevent Alzheimer's. I was going to say the sedentary lifestyle, where I have noticed working for 40 years as a nurse that nurses are very notoriously the least healthy people in the world because of being sedentary. Now, there are, of course, many who aim to exercise every day, but a lot of them do not. So people in general are sedentary. They start being sedentary in their 20s and 30s. And this is interesting to me. So exercise not only strengthens your body, but it also strengthens your brain. And studies show that aerobic exercise can help grow new neurons, especially in the hippocampus, which is the part of the brain that is responsible for memory. Yes. So resistance training can help the brain by releasing proteins called myokines that release it from the muscles. These myokines help increase plasticity, making the brain more resilient against diseases like Alzheimer's. So we need to get 150 minutes of moderate exercise per week, and we need to include resistance training 3 to 4 times a week. So what I do for that, and I have started to do this every 3 or 4 days and take a day off, is I have an exercise machine that down, squats way down to the ground and up, and I do that 100 times at a time, and I don't see any reason to increase that because my legs are feeling it, and so I have to rub magnesium ointment into my legs to get them to feel better. And start small if you're new to exercise. Don't go full Monte. Just add a daily walk and make a difference. So walking and maybe the quick aerobic, say from one spot to 150 yards away, you run and stop and keep walking. So that helps too. That can help a lot. And nutrition. So let's focus on that for a few seconds. That plays a huge, huge role in brain health. Your brain is made of 60 to 70% fat, and it thrives on healthy fats like omega-3 fatty acids that are found in fish. And it's important to notice that dietary cholesterol does not directly feed the brain, but omega-3s do. So we need to have an omega-3 rich foods in our diet, like fatty fish, or consider a high-quality supplement. As I have mentioned, Dr. Gundry has several of those in his repertoire, and I will put that below in the comment section. So, incorporate these omega-3 rich foods and focus on antioxidant rich foods like berries, nuts, and leafy greens to help reduce inflammation and support the brain health. Avoid sugar. I think that's a good idea. That can damage the brain over time. And so Alzheimer's doesn't have to be inevitable. And we can prioritize sleep. We can engage in regular exercise and maintaining a healthy diet. We can significantly lower our risk and keep our brains functioning optimally. So don't forget to check out a video that comes up over here and subscribe. I'm trying to get to 1,000 subscribers by the 1st of January 2025. Thank you.